sense of trust and personal bonding, there's a much better chance that the screenee will want to participate in ALLHAT. Read all study information in a fashion that the participant understands. Participants should never be made to feel uncomfortable because of a lack of reading skills. Here's a list of key items you should cover with a potential enrollee.
First, explain that ALLHAT is designed to identify the best choice of drug therapy for the treatment of high blood pressure and high blood cholesterol. Explain that there are several families of blood pressure medications and that they will be treated with an ALLHAT blood pressure medication from one of these families of medicines. Whichever pill they receive, they can be sure that it is one which is in common use throughout the country, and they can also be sure that it will be a medication which is effective in lowering blood pressure. Likewise, if they are in the cholesterol-lowering component of the trial and assigned to receive drug therapy, they will be treated with a medication which is already widely used to lower blood cholesterol. Next, explain the meaning of a double-blind trial in language that is easy for the patient to understand. One approach is to tell them that for scientific purposes, neither they nor their doctor will be informed of their ALLHAT blood pressure medication assignment. However, their doctor can easily obtain the name of their ALLHAT blood pressure medication if there is a medical need to know. Next, inform the patient that, as for any medication, there are potential risks associated with taking the study medications. Reassure them, however, that the medications are all in common use in clinical practice and that most people will not experience any important side effects. Explain to them that if any side effects do occur, their doctor will be able to decide if the medication should be changed or stopped. Stress the benefits of participating in ALLHAT. These include free medications, free lab work, specialized care and monitoring of their blood pressure, blood lipids, and other health indicators, and a chance to do something important for people their age and also for their children, because risk factors for vascular disease tend to run in families. Also, tell them that those who participate in clinical trials tend to have better health outcomes compared to those who do not. Make sure that they understand the importance of their role in the trial. Also, make them aware of the responsibilities that go along with that participation. They will be expected to take their medication as prescribed, come in regularly for checkups, and contact the study nurse or doctor if any problems occur. Stress that although participation is voluntary, we are looking for a long-term commitment to the program. For our part, we will continue to follow them until the end of the study.
Potential enrollees often have concerns and they may raise tough questions. You must be ready and able to answer these questions in an adequate fashion.
I don't want to be a guinea pig.
Well, I pay very little for my medications as it is, so free medications from ALLHAT is really not that important to me.
Yes, I'm concerned. What if I get a side effect from the medicine?
Try to change the negative tone of these questions by answering them in a positive manner. The accompanying guidebook contains examples of possible answers to these and other questions. Learn the material well so that your answers are natural rather than scripted. If you are not sure how to respond to a question, excuse yourself after noting that the participant's question is a good question and find the correct answer, or get another ALLHAT team member to address the concern of your participant. You should make sure that your patient has all the information he or she needs to make an informed decision regarding their participation in the trial. Meeting family members or close friends before the patient is enrolled in the trial can also improve patient adherence during the study. Once all of the participants' concerns have been addressed and you feel that he or she will be a good candidate for ALLHAT, ask them to sign the consent form.
Adherence and retention are key issues for those who've been randomized into the trial. Remember, prevention is far better than cure. You do want to meet your randomization goal, but don't be tempted to recruit people in who you think may have a compliance problem later on. Once the patient has been randomized, do everything possible to ensure that they maintain their interest and commitment to the study.
Try to make ALLHAT visits as easy and convenient as possible. Make sure your participants know how to get in touch with you or another team member to discuss ALLHAT questions in between their visits. Send them an appointment reminder by mail about a week before their ALLHAT visit, and contact them by phone the day before their visit to make sure they plan to attend. Try to assist with transportation problems or any other impediments to full participation in the trial. Try to spot early warning signs of a pending problem with adherence or retention. Such signs include a lack of understanding of your instructions, delayed or missed visits, or unexpected or frequent complaints. Make a special effort to intervene early, before the problem becomes intractable, by identifying and resolving the underlying causes. While you must respect the right of a participant to drop out of the program at any time, try to avoid this at all costs and generally maintain a never-give-up attitude.
Finally, remember, you're not alone in this project. One of the strengths of ALLHAT is that you have access to a large pool of experienced colleagues who are willing and anxious to provide you with help. Take full advantage of this rich infrastructure, especially your regional nurse and physician coordinators. Recruitment and retention of study participants is a challenging experience. However, if we work together and we follow the previously mentioned recommendations, I believe we will be successful. Good luck with your efforts to recruit, retain, and enhance adherence at your clinical center. Don't forget, you hold the key to success in this trial, and your contributions will play an important role in shaping the course of patients at risk from coronary heart disease and stroke.